Hi, everyone. Thank you for joining us again on a new episode of our People Power Health newsletter. Today, we have a very special guest, un amigo. I am very happy to have Dr. Pablo Buitron here with us. Pablo, welcome.
Thank you, Sam. Thank you so much for inviting me.
The way we start, Pablo, usually with our guests on these interviews is asking them if you walk into a room with people you have never met, how would you introduce yourself with them? Who is Pablo?
Yes. So I'm Pablo. I'm a primary care preventive medicine physician. I'm an immigrant from Quito, Ecuador. I'm a husband. I'm a proud dad of a puppy, and I'm a person that's very interested in working to really help others and to really close disparities and injustices that I see. I think I am somebody that grew up with a lot of privilege. I always had everything that I needed when I was home. I did medical school in Ecuador, and I never really had any need besides just the time that I was having to spend on that. That's something that really is important in my journey because that was something that while I grew up in a family where all the conversations were about social justice and activism for the things that my dad and some others in my family used to do, I never thought that I would be doing work related with health equity activism. Like, to be very transparent, like the reason why I started medicine was because I thought that was the hardest thing that I could do. And I also taking care of people since I was a very young. I had pictures of me like trying to, but my main goal was to do the hardest thing. And when I was ready to quit med school in my fourth or fifth year, I really started doing my clinical rotations, and I found that I really liked sharing illness with patients, sharing illness with them, and that's how I started really going through this. And then all my life experiences really have gone through that and changed to take me to like being a physician activist and health equity kind of agent.
So that's quite interesting, Pablo. So you grew up in Ecuador, right? And then, do you remember that moment when you decided I want to go into medicine, which is the hardest thing available? How was that moment?
Yeah, because I in my family and in I think because I grew up in a position of power and privilege, there was a lot of elitism. So you could see everyone around me really trying to get a better job or do something that is like or more special, more important. So I was really embedded in that really worldview and ideology. So that's what I wanted to do. So for me, it was sitting down and seeing, like, okay, if I choose a profession, which one will be the hardest thing for me to do? And that's how I did say, okay, I think medicine is going to be, because that's going to give me also a new position of power, right? And the doctor de la familia. Yeah, so
Yeah.
I think, to be honest, that's why I decided to be a doctor initially.
Okay. Now, I am curious. Okay, so once you went into medical school and you started learning about not only health as a biological science, but also as health in respect of disparities and lack of access to healthcare and those other topics that we can see when we start medical school, was there any specific issue or any specific disparity during those school years that started to shape the way you were looking at medicine?
I think the exposure that I had in my med school to kind of social medicine was really high. What was interesting it was even though the exposure was really high, it was not until like I came to the US that I started really having a clear grasp and understanding of the impact of being exposed to social risk factors or and I think it was probably because of my position in Ecuador as a white man studying medicine. I didn't really connect. It was hard for me to. It's not that I didn't understand, and it's not that I was really engaged with my patients. We could see their struggles, but it was never in my mind. Okay, this is priority for them. This is priority for me to be able to provide them better healthcare. Yeah, so similar to my family was all about this. My med school was all about social medicine, but it never really clicked until I became an immigrant, and that really put me in a position where I had to experience things myself, and that really changed really all my trajectory.
Okay, thank you for that, Pablo. So then let's move on in time. You get into the US and you start now your training in the US, as you mentioned. And were there any specific moments during those years, either a specific issue or a challenge that you encountered during those years that made you think, I really want to go into health equity and activism?
Yeah, I think my residency is when things are starting to make sense. I think I started really finding how much when I liked education. I really enjoyed education a lot, and that was something that I really liked. I really wanted to be an educator. But I had a lot of experiences of discrimination and a lot of experience of injustices as an individual person. That really is what led me to this. And specifically, I had a really hard experience before when I was in Detroit, in Michigan. I was living there with Andrea, that's my wife, and we were gonna get married, and my family came to visit us, and it was really exciting. And they came, and we were all there walking in the river walk, and just being super excited for achieving this really the hardest thing in my mind. You're like, oh, you're the doctor, and now you're doing residency in the States. And my abuelitas were proud of me, and I was like, oh my God, I'm gonna get married, and this is all good, things are working out. And my parents were like super happy about. And I was like, okay, I'm being successful. This is success. I've been working hard, and it's working. And that day I was walking, and then suddenly I'm seeing like this guard coming towards us and asking for our papers. And but he was talking in Spanish, asking, like, saying that he was planning a trip to Spain. And but then things changed, and he got upset and asked for our papers, but we didn't have them. And I get really nervous. It was like a thing that happened, and because he couldn't find our papers. And then suddenly, like, he found my mother and my father's papers, but not mine. And he shouted, "You're an illegal in this country until I can find you." And then he called ICE, and ICE came with these two big keys. And I was in the river walk, and I'm seeing these two guards going down the river walk, and the people are dispersing. This is a Sunday with a lot of people there. And they take me to the SUV, and this is very shocking. I sit down, and things are not making sense to me, like thinking, like, why, what happened with all the work that I did? I worked really hard. I was like doing the things that I needed to do. And suddenly now, only because of my immigration status, I was gonna lose everything. And I'm like shocked. I'm like traumatized. I'm like feel frustrated, feel impotence, that I don't have control about anything, hopeless. And that's the point where a lot of things clicked. I thought about my medical school classmates that were like really having challenging times because they were not from the city. And my patients that had a lot of struggles. And that really clicked. And I was mainly having an issue with my immigration. My patients, the patients that I took care of in Detroit, and my friends, it was harder for them because it was exposure to racism, exposure to a lot of other systems of oppression that are very common here in the US. But then at that point, privilege kicked again, and I could see the hospital where I worked on. So I shouted, "Hey, officer, that's the hospital where I work, or that's here before." Then they stopped. They changed the demeanor, of course, because you play your doctor's card. And then they took me back to the river walk. I'm walking down the river walk. Everyone disperses. This is the biggest drug lord escaping detention. And but at that point, like, everything is noise. I'm just trying to process the traumatic experience, give thanks to the privilege that kind of saved me in that space. And but that really made me think. I really want to work to make sure that everyone has the same opportunities that I've had to be really healthy, successful, and be able to thrive. And that's when my path into working on health equity started.
And thank you for that story, Pablo. And now that you mentioned that, and with that we are moving into this new part of your story, I want to ask you, you have been working in your institution for several years, and you have been doing health equity work there. How did that work started? What challenges, what issues were you noticing that the work on health equity issues started so that you could address them? How did that started?
Yeah, it was interesting because when I did my preventive medicine residency or fellowship after my internal medicine training, during the preventive medicine program, it was eye-opening because I initially started with an idea of doing an education initiative for patients with diabetes, and I did an education using graphic organizers to help them organize their things. And I was really connected with that. I was like, okay, this is going to have great impact. And while I finished that project successfully, I realized that while I was doing these maps of the patient's health, like the patients were doing they were drawing their health, I I was able to identify that it was not necessary that they didn't know what they needed to do. It was that they had these really harsh circumstances. Many of them didn't have a house. They were experiencing homelessness. They were experiencing food insecurity and all this. And that made me think, if I really want to have an impact on my patients and give them the same opportunities to be healthy, those things need to be addressed. And I started like exploring in the institution what things are done. And I work at Boston Medical Center, and it's an institution that has years of work on and trying to address inequities and injustices. But I saw that there was a gap in terms of there's not like a systematic screening process that where we can ask patients as you check blood pressure, as you check their heart rate. There's not a process where you can do the same thing for their social needs. So if we don't know and patients might not feel like open to disclosing those things, how can we address them? And at that point, we had some patient navigators and things. That's when I started like working with, I guess in that case was my first mentoring in equity work. That was Dr. Arvin Garg in pediatrics. That he was doing some of that work in pediatrics, and that really clicked. I said, okay, this is the first thing that I need to do. I need to implement a process so that all patients can be screened for the social needs, so that the clinicians know what are the social needs, and we can start doing things to address them. And I got really excited, and that's how I got my position of leading the Thrive program in BMC. That's our social determinants of health screening and referral program that I really love and I feel very passionate about.
Thank you, Pablo. Could you share any specific example of how this work that you have been doing has been successful in achieving change, and has been like maybe some short story or some experience with either some of the residents or with some patients? Could you share one example with us?
Yeah, and I think that's when I started. Those were probably my first experiences with the power of advocacy, the power of community. I remember when I had this idea of, okay, we should screen all patients. Uh, all these conversations and all these tables that I was being able to sit, there was a lot of pushback. Like people really thought that this was not possible. That yes, it's something that we should do, but we don't have the resources. It's something that's really hard to do. How we're going to do it? And that was maybe my first advocacy kind of job that I had. I said, okay, I really think that this is something that we should do. What do I do? So first I went, I presented, I did all these nice slides and presented it. That didn't really work. So what I did is I really started getting key stakeholders. I started meeting with people like, okay, who else is interested? And let's push together. And we pushed together. I got another mentor, that Thea James, being instrumental on this. And she really became my mentor, my sponsor. And we all pushed together and we were able to get the money that we needed for this, because we needed the money to really implement this. You need the money to do this in the hospital. And we were able to really connect with our leadership, develop a strategy of what's important for them, what's important for us, how can we link this and show that this could be, and we were able to put it in, and we are able to screen all patients for this. And now, because we were able to do this, now all the other hospitals in the state and in the country saw that this could be done, and now everyone is doing it. And our hospital was one of the first ones in the country that had an automated process of screening for social needs in the electronic health record. So that's when kind of this individualism ideology that I had for so long started getting dismantled. Like I could have never done this by myself. It doesn't matter how smart I think I am or not. Like it was because I had all these great people that were passionate about this, and we were just pushing and thinking that this is a great idea, and it was great. I think that was my first job that I can remember as as a physician advocate, like really advocating for moving that one.
That's amazing, Pablo. Last question before we start closing the interview. What are some of the next projects? What is coming up in your work?
Yeah, I always remember this conversation that I had with Peja. At some point when I was doing some more health equity training, I started like getting very very upset and very kind of fired with a lot of the injustices that I was seeing. And I remember I had this meeting with Peja, that was my mentor through the program too. And I asked him like, "There's all these things, there are all these fights that are in front of me. Like, what do I do? I'm just getting frustrated. I think these injustices and discrimination is just hard. What do I do?" And he told me something that I always remember. There's always going to be fights there. There's a lot of people fighting those fights. You have to be strategic in terms of what fight are you going to choose and what fight you're going to put your effort and everything there. So I think my fight and my fight is really being able to figure out ways of effectively addressing the social needs that patients have in the hospital, acknowledging that yes, those have a root cause of the systems of oppression. That's what I feel. That's my fight, right? Yes, and I know that there's people that need to do the fight in the community and changing policy, but that's my fight. So I think the next steps are really growing that program, and to grow that program, we really need to start thinking about um, how can we better understand and partner with the community to address those needs. And I've been working these last few weeks in this really exciting project where we got 9 community organizations actually to partner with us to develop a better process, better protocols of how to help patients with social needs. And same thing, like I think with this new approach of I cannot do this by myself, like the hospital cannot do this by itself. So getting and kind of how you engage the community partners, how you really understand what trying to understand what they need and bringing them up. So that's one of the things. But the other thing is even if that works really well, I think there's a need to to change the way that we educate healthcare professionals. So that's my other passion, like how to use this liberation health method in clinical practice to really change how we think about social structural and social drivers of health, to really think about what's our role as clinician, as acknowledging those needs, connecting patients with different things, but also advocating for the patients at the individual level, like when they need a letter for advocating for housing or things, but also using my position of power to really start doing things outside the hospital. So I've been starting to go to the monthly meetings of my neighborhood where I live in Roxbury, and it seems that they are like have a lot of story of being advocates. So I went to the first meeting a few weeks ago, and it was pretty amazing because I'm there as one more person in this community, and just seeing this group of people that just have this much strength and this much strategy of how to do community organizing. Learning more about that is the next steps. But I'm just really happy what I'm doing now, and with the opportunities that I've had.
Thank you, Pablo. And last thing before we close the interview, is there any book, movie, podcast, any kind of media that you will share with people, with our viewers, that could inspire them to get more involved with health justice and health activism?
Yeah, I think for me, what was instrumental in terms of all these thoughts that I had to put it in a simplified approach or simplified way of really understanding what I'm doing is this model of liberation health that one of my mentors, Dawn Belkin Martinez, that she's a social worker and at the school of BU School of Social Work, that she developed this model. And this is something that I think it's been very helpful for me, and I will encourage people to look for it. And it has a short 5-minute video in YouTube if you put Liberation Health, but it also has its own like book of how it was developed and what it is. It's really grounded in this idea of that there's health and is about so much more than just social needs. Is about the institutional, the structural factors, the cultural ideology, and how they all interact between each other, and finding your place in there, finding your fight. What's the fight that you're gonna take there, and to keep moving us towards achieving health equity.
Thank you, Pablo. This has been an amazing conversation. Thank you very much for making this time. And do you have any last comment, last word for our viewers?
It's always exciting to share this, and I think as physicians, as a healthcare professionals, I think it's always important to understand, to take a moment and acknowledge our position, our positionality, our identities, and see how we can use that positionality to really do the work that needs to be done.
Muchas gracias, Pablo, and thank you.
Gracias, Sam.
See you next time.